Makida, when I'm in black, then it is life. I've missed you guys. Hey, it's been a whole year, and I do it. My film, papa. In fact, my film to say, empena ne tofe no. My film too much. I hope we are all doing well. I love you guys. I love you. I love you. Love you. Love you. And I welcome you to another great episode. Now, our pending issues, baby. Internet say yetimi hwe yetimi komuna yehwe bibia. Today we have doctor on set. Ono na abeka asem eburu asem nyina so na na enidi omotwe ne sere ne abasa wafa no ho tetete. My people, you are on set and now you are in the comment. Azalu Felix is here. I think she's the biggest. Indeed, we are the biggest. We are the largest. We are the greatest. In fact, I am the tallest. I am Africa's only sun goddess and only spiritual visionary. Omo maka ni na yebi. But I am the mother of all spiritual platform. Hey, I welcome your guests because I know you come on so we are 105. More like it. Mumia, so mobile mumia. So, yes, I mean, can't you? The catcher man come so today, doctor is on set. We are going to discuss a lot. We are going to continue the conversation we had the other time. The phone lines will be open for all of you to ask him your personal, question. Akwaba, doctor, memo akwaba. Yo, onya ho se say nti chi ahwefo no na afi ye nhwe de ebeko.
Onyina, ye do mase. So onya abotre even though I late kakra. Ye do mase no ma abotre. Ye promise omo egu show ene enwumre. Ye do bibiase.
Yo, and your doctor mo akwaba kese pa. Abusia, we apologize. We apologize for our lateness. Ye pamochopa na ayi. Mo amunim se em sense amanfo abakrom ntumi traffic na wokrom ho na ewu. I had to say different bisa no. Into na ya late kakraba. We are still here. We are going to consume our 2 hours. Internet just say about 9 o'clock. Into bibienya and say mo abroche na nka say moda by this time. I actually mo gina mo kafra na mo franchise baby phone lines no. Na mo ebisa mo question. Doctor, you were here the other time. Mo comment section ni mu nyina, mema mu nyina akwaba mo draw so. Inti se mebubodi na ebeche Gabriela TV o wahanomu Isaac Kojo Esel mo wahanomu all the love people are here. Sarah Bwampon ono so e waha Franklin we are fi ejekum ono so wa Steven Dazi e wahanomu modoso Suzy Sa mo nyina welcome all of you. I appreciate you guys so much. Inti doctor, you were here the other time. And now obey we show no. Inti, is there anything who ye whether or comment session and na bibi wa wo so obi wo kan ya obi ante wase a wo be pese wo be address and na say bibi a kwanya wo ho no.
I'm grace me da wase. Me da se wasan so ama me akwanya bio na enne ya wada enwumre nso. Ye ne ahwefo ene etifo ebeto ankomo a yedi etwam eye bia na wotwemienu a abesen ko. Niema bebree na mate niema bebree na mawidi ewo nkoma a yebebo ye no ho eye chakras no ebi kra na obi ntida ebi mu nso se na o mate na omunim dwumedi a anase mfasodi a na ewo ma enipedua no minya few patients ebi mu from Kumasi ebi free takrade omo ye mpanyimfo a otimi se o mate sa nkomo yi hu nsem bi kakra nanso ebra mienu agi akonwa na ye mpensempense mu even though ye ntimi enwie nanso kakra omote ye no omutu anamon eba manim ema ahemfo tu anamon ba manim ama meni omo eto aso ebo nkomo kakra enti no feedback anase de minya ye de bebree na nenso meni beji se ye beto aso na ma ahwefo ene ona ewo nsembisa no nso ombeto aso na omebusa me na metimi eyi ano na bibia me kan ya omanti ase no ene nso no metimi anya akwanya na metimi akyekye mu yi ama omanti ase
ye mo akwaba
yeah
abusia media me ka kire mu the other day say I have 3 questions for him but now your time no aye be intimate me mbisa nti em say me take advantage me bisa all the 3 questions no na afi ya to aso na ya hwen komo na ya bie phone lines no and ya mu day mo na mu bisa questions so me take advantage the other day episode na ye no you made a statement no na me feel say me na me what problem with it
all right
and na I feel say show no call ye no so no na other people also have problem with it
okay
and what was it we say obi be pay ejuma
yeah
no we nya 35 years
yes
oni boyfriend
okay
oni banso so
right
sebe enti no na you find it difficult oni pot sa oni wa wo ba kumpo no oni kunu anka ra me what believe bebre like me beliefs bebre
right
obi nye obi a na betumi awo e wasase so sebe ene nye obi a so no be esese oware e wasase so sebe enti sa asem na wo kan ye no na eno na me pese me bisa question but na ye time na bro so kra pa ho Inti Sasem, no, can you address it and give us the reason why you made that statement and the reason why you think so?
Right. Thank you.
Welcome.
Medasi pa ne akwenya na dedi kan say bia nkofukuo bi ebe fi say bia maye ayipamu anase maye discrimination in the sense that makasa obi a wedi 35 years anase wedi mfie aduasa enumu na ontimi enware ye na ontimi enwo ye nso no mintimi fa ne nye adwuma no ekuo bi anase ona waje manu esi bone no omofa nche me that's the first apology na afi me nhyase emfi obo ade nyansa pomu no obo period anase time nti ye fa bibi human cycle so the cycle of fate I don't know sebia what sa mpanyin semina so there's a cycle of fate of everybody every human being enti oba efa yefunu a ne second to third trimester wenya 25 weeks bosome enson mu no nyinsen no otimewo pacho otie so oba fa yefunu na onya bosome enson a otimewo ma abofra no oyeye but bosome nsia ontime nwo bosome nwotwe owo a akra ne enyeye tise bosome nkron ne bosome enson na abofra ne beyeye so obo ade nyansa pomu no ade enson bia to me ewom anase there's a strong positive energy in that 7 na sa enson yin so na da enipa brabo ho ekosa kopim se enipa benya 144 years ansa na free asasi so enti so ne mbe ya adwen a wo abofra eto ho nye na wa nante kosi bra obedi mfie nson a ontime nante bio so wo abofra eto ho enne na bosome ekosi mfie nson wantimi anante asabi waye bafan free mfie nson anase from age 0 to 7 years enema bebre ho a ewo se abofra ehu ewo ne developmental stages nim enti what the ba medicine mu a yewo developmental stages so what you say enti wo ne to ho no obewia obenante obesua se de ye kasa obesua se de didi up to 7 years ewo sa abofra hu se de odidi ono ade ne sa ebedidi from 0 to 7 no ewo sa abofra na atimi ede ne sa edidi ewo sa otimi ka mama dada otimi ka few words bia otum se ne ho etwa from 7 years to another 7 years 14 years 14 years no ewo se nipa no otimi esua se de ye siesie ye ho ye shatade ye bu nipa ye bre ye ho ase esom nti abofra oba from age 7 to age 14 ewo se ohun se de ye si ebu nipa ye hu se de ye si som nti wo ba ewo fie 7 years to 14 years onim se de ye pra onim se de ono anu aduane edi onim se de ono asi ne nioma a onya age bia forget it ontimi nya bio eno the second period and as period 2 so you have period 1 0 to 7. Period 2 7 to 14. Period 3 from 14 to 21. From 14 to 21, ɛhɔ na abɔfra no enyi a wɔhu sɛdeɛ nti sɛ wohwɛ a yɛn nananom no ne abɔfra anaasɛ ɔbaa edu ne third period a ɛna yɛkye ne bra ɛde ne ma bɛrima nti from ne third period ɛyɛ from 14 to 21 years no ɛwɔ sɛ ɔyɛ ɔbaa a ɛwɔ sɛ wohu efiade yɛn nyinaa ɛwɔ sɛ wohu sɛdeɛ yɛsom bɛrima ɛwɔ sɛ wohu sɛdeɛ yɛsi ɛgye abɔfra ɛto yɛn nan so yɛde akwaraa hyɛ akyire nso ahwɛ yɛn nua mmerɛ na yɛwɔ akuraase no yɛn mmaa no na yɛtaade nkwaraa no hyɛ wɔn akyi from 14 years ne maame kɔ afuom na ɔno na akwaraa no hyɛ n'akyi nti ɛyɛ adeɛ a na yɛ instill into them nti ne third period no so from 0 14 21 how many period 3 periods so fourth period from 21 to 28 years that's the fourth period of a human being nti ha no nso no wanyi wayɛ full grown man anaa woman wastarte wɔwo now Mami Grace yɛka saa nneɛma wei nyinaa no na yɛ narrow it down to yɛn physiological moods sɛnea yɛ honam akwaa no nso ɔno enyini fa nti from 21 years to 28 years no ɔbaa reproductive ayɛ so sharp hormones ayɛ so sharp ayɛ matured nti sɛ wode wo ho ka bɛrima a wanhwɛ yi a na wakɔnyem ɛno nti na sɛ wohwɛ a abere a ɔbaa bɛnya 21 years ɛde kɔ no nyinaa no sɛ na awofoɔ no ɛpɛ sɛ ɔmo pɛ abrabɔ bi de ne fa so a ɔmo yɛ very strict because ɔmo nim sɛ saa no wayɛ so the hormones are so ripe that ɔkɔyɛ mmɛmasɛm sisi a ɔde nyinsɛn ɛbɛbɛ fie ɛno no yɛ the fourth period fifth period ɛyɛ from 28 to 35 years ɛhɔ na asɛm no wɔ no a mekɔ kan deɛ ne nti a mekɔ kan sɛ obi anya 35 years na sɛ ɔni kunu ɔni baa for me ahwɛfoɔ nhyɛ biribi nso sɛ ɛyɛ me manka sɛ nipa no ɔnyɛ adwuma nyɛ so wate aseɛ
ɛwɔ na wɔ rules and regulations
yes na deɛ nti a meka asa ne sɛ because that time no me no me fili ma obi a ɔpɛ ba na ɔnya ɔpɛ kunu na ɛyɛ me passion to be honest with you ɛyɛ me area me bɔ me ho mmɔden paa yie sɛ obi a ɔpɛ baabi ɔbɛba me center no ɔbɛtry sɛ ɔbɛnya ɛba nti ne sɛ ɔne me ba bɛyɛ adwuma at that time no wonyaeɛ a ɛna me nso meyɛ obi a meyɛ demanding meyɛ very demanding meyɛ boss anaasɛ meyɛ entrepreneur a me ne woyɛ adwuma a meyɛ very demanding obi a ɔhwɛ me bi a ɔne me ayɛ adwuma da bi ɔbɛka kyerɛ sɛ wusu ansa deɛ biribi ansɔ n'ani because woyɛ a ɔsɛ woyɛ ne yie so ate ase nti na me saa position a na mehwehwɛ no so no na mepɛ personal assistant mepɛ nurse a me ne no bɛyɛ adwuma no hand to hand so ate ase nti ɛbɛyɛ demanding ɛna wɔdi 35 years ɛna biribi asɛe ni hɔ nti mebɛgye wo time a wode bɛtena ase sɛbi ebi a wode bɛwo anaa wode bɛtena ase ahwehwɛ partner na afei ɛmmaayɛ na me nso megye wo time a ɔn sɛ ɛbɛyɛ wɔntwi
wɔntwi. And partner no, do you have to go and sit at a particular place looking for a partner?
No, you don't have to, but you need time for your partner. Obi a afi na wobɛhyɛ ase saa no wohia time.
So in this case no dey nipa na obetumi ɔmo aware akyɛ ana ɔmo aware foforo ana obi a ɔware na adwen so ɔnware.
Oh, that fine. Oba okay, so it was an interview. Enti me busa so okay, waware or say there be opese oware ana or say ai dey enti na onware ye. Oh, me say enti na me nware ye. I'm so okay. Dey enti na onwo ye. Oh, be believe am wo mu no enkyere me say me nwo ansa na maware. So what I say. Enti on say ene me believe you know crampo enhye da enni chaka because me there's difference between awo and aware. Ewo me book mu no.
Book ben no.
Oh, say obi a won philosophy.
Okay.
So what I say. So in my philosophy, there's difference between awo and aware. Obi betimi aka say me ware, me nwo. Obi betimi aka say me wo enso me nware. Enti se mu bia no na owo mu a enka me okay, but we dey or say oni mu bia Now, back to the periods now I'm making. So from 28 to 35 years, it's your fifth period. Or your fifth period, or hormones be reduce sharply about form. And so from 13 years of baby, so that's the time of menarche to the time of menopause. No, men's is an etibasa say a basis. So with your menarche age, which is the 12 years or 13 years, you could flow 7 days of your menstrual flow. Then we'll do 28 years. We'll do 28 years. No, maybe a swat be 2. Until 7 days, I won't say about 5 days. We'll be 35 years. No, now we're in 7 days. Now, to say about 4 days. You'll be phone lines. I'll be live. People will attest to this. But 35 years, women is now when you're 6 days. To say about 4 days and 3 days. By 35 years, women is when you're 4 days. To say about 3 days. Bibia so hormone bia so 80. So what I say. And to say oh trimupo oh your ba wo trimupo say o pese o start o family dia in that cycle of life and faith, you know, my guidelines say by age 35 years you should be able to finish or you should done with marriage. And then so anya ware no po na bia where wa just on worry baako akwala baako na mienu de also timi de to ho na afi otoa so nti even in school ladder no your bachelor and your masters your bachelor we are on say wo be 25 26 then obi obe na bachelors awie bia no obafie pa aware na wo dwen ho whether consciously or unconsciously minimum so na me ya adwen a obi obewie ne first degree bia oba uyi emma 100% emu 80% after their bachelor degree they want to come home and start family omoba ebe wo ba ko mienu miensa afi na wotoa ne masters so after your masters no ubewie your masters no bon say wo 40 na che say 45 years na afi o period no mti ewo mu up to period 7 but period 7 no where you will be your grandma, your grandpa. I just say, Abrabo no.
And you know, who calculating it from who side?
Exactly.
Now we you who will be when you 50 years I would.
Me anka some feel the dear, me who will be a
bounty be so that. What?
Mate.
Until with God.
All things are possible in the hands of the universe. Bibia me mate crampo say obi o only womb. Not only womb, but the person was able to conceive. Exactly. So these are some of the things.
Exactly what?
That is exactly the question you are asking about finding that hefa. You say not only womb, but because bibia and so oba de ne yenti no. Otimi aye amanaba. Until me cycle no de. On say nyoma bi o ha, you don't have to struggle and get it. That is how the universe did it. Certain things because they or they are mayan and to say a panwa, that is why it becomes difficult. Like these cycles they are making. Say abofre bia obetimi ahu nioma yabobo bosi. My main story being sure. Na me koyi miti. Ewo barbering salon. Ewo West so small. Some of the comments ni bi obi say akwa me ni baby ote.
I don't want to go ala.
So me tell West so small area ho.
Okay, o
It's na me ko yimiti or West so small na me koto guys young boys miensa ba ku yi na mienu ete ho na omudi nkomo nti ba ku asma ka chana dan for so wenya ne be memu aye ne ya achepa wa ye do ne papa de na ko hospital sa wa ye sa enko nti me is drop here nkomo no na me busa ne say we didn't feel say because me share the age na or your teen age and then busa ne say we didn't feel say na no say 16 years and I'm so any na yare na enko
Did you say that?
I said that. Yes. So not yes to yours, but I mean, me can't say we are in an enko, in yanko. No, but some say that are there. And I'm so oh, time I would do here now. They sex in the we are in an enko. na mbusa say why sex say no say oh on my best 7 and ada
16
years yes and I'm kind say na yare ne de enko
mpacho enkwamba
right ebeko
fe na me bu adwo me oba tan yo ntin se mbi wa me
nti me church no me and I started this cycle no from 0 to 7 there was say nipa bia uhu from 7 years from 7 to 14 I was say uhu from 14 to 21 we are not supposed to have sex within 14 to 21 you are not supposed to have sex
hey
yes
and ya sam na serious go Ghana
yes
12 to
12 14 to between 14 and 21 no organs no reproductive organs no so sharp they are so active bibia be komu bia no emoja wo mu bebre ana say so ahodin wom so what I say enti e de ye adwuma e de kwa akiri enti me church boy no asoma boy no be kan say papa we de o ye sofo de ana sorry de wo kwa nka wontimi mbo adwaman yo asoma akwa na ka chere me no
say ade ne ye di nyame ato so ade so ye fact wo the body ni mo nte ase
so
you are watching the biggest so until you say a year to 21 and they say they ye nya obi enko heaven na mo fra 14 no ma sha
heaven no
I mean I dey heaven abem say no na ye serious no
okay
me na me dey heaven abem enyo owuo na say heaven ye che owuo
right
you are watching the biggest and the largest my people Elizabeth Annan we love and hate it we don't like ambitious if you see my sister is 35 but still having her period for 7 days.
Right.
Stephen Dazi.
Okay.
See, he tells the bitter truth. Right. Just that Ghanaians don't like the truth. I know there. Listen to his explanation. It doesn't change the fact. But Susie said, Mommy, please, I greet you. Our guest. Please, my question is, I'm 24 years. And I've given birth to 4 children. Hey!
Right.
You're fatal.
Right.
And would have been you, Mama.
That's good.
And I want to add 3 more.
Right.
3 more, but nurse told me to add only 1 because I can lose my womb.
Right. Yes.
That I don't understand.
Right. So it's not necessary to say obey losing a womb. If you have a spontaneous birth delivery or child delivery, a bit me am when you prolapse or uterus no. A bit aba form.
And then I know mo yefu na aba form. Mo nyim kura na aba form.
We are wodi na nkasa. And a aba form. Ti awodi anything be share.
And mo ye surgery omu yi.
E be share one name. E bit be share wa hem one answer be share which so we call it cystocell. Se be share baby a odwon so fa na e fe na cystocell. And e be share baby a woto uja wona fa na e retocell. Nti prolapse se wochim bebre na e betimi abema wa wodi en ate aba form nti wodi kan wo 4 enti nursing no onti nursing advice
no
so
fa ba ko eh na ye ne yesi ya wutan
enti saade a obetimi akọ surgery I mean CS wanyim bia o me yentwa so that on push because
now on stressing
exactly uterus no
but ye nananom yi no mo 15 year dey na nu kwa fie awo and they were there they didn't get putros
they were there just that there were no data to
recall
exactly they were there.
But no,
I mean, prolapses were there. I mean, most of the cases are because there were no data like now. And I mean, technology, yeah, they been far data. If you say,
technology, they were giving birth 15, 20. So 90, 100 and so what's the point?
They go through problems.
And they survive. They don't die. Our own small problem, we are dying with all your technology. So what's the point?
Yes.
Doctor, what is the point?
You see, we have in medicine, we have idiosyncrasies.
Bro, we na idiosyncrasies.
Yes.
Idiosyncrasies
come. Ideo. Until we will say, anyum idea obe femu no, ekuya femu a, ebia obe. So what I say.
That's what I'm saying. We are different people, different system. We are the strength and the abilities. So why do we use medical terms to classify this? If you are say, you to me, I say, me,
you data. na ya hwe nipa dodo say and a call a foul how ma
the majority carries the vote. I had to say election. Why and them yeah. You are watching the biggest and the largest. Okay, my people are here and I think they have plenty questions for you, but I'm not going to ask the questions today. I want 52 children who Maame Grace. How do you hear Bearman to me? Exactly. Bearman, they need limitation. Hey, Emma, they who are religion a problem. Over her problem. We are just limited.
But most of them the Muna Bibia, Oba na Bibia, you are the initiators. Oba and Bibia. And yes, because that is why I carry a lot of energies. Now, energies and so a santem. Energies are very sharp, very, very powerful.
And he has a lot of responsibilities. If you cry when you are with sir.
And now me once me ba na me catch say abroche for no e frefre me. Na me nya couple bi a na omo issues na me pese me settle. Wonim say be manyi a ni age bi a wodu bi ano. The 15 ages a film 15 years a film.
Explain.
Okay, so to say me age say bi a me 50 years me who say me 35 years.
What do you mean?
Imagine.
I didn't hear.
That's how God created us. That's how God made us.
Mu deceive him.
Sir.
Mema mu deceive him.
Nti bon say onya ne bia no bon say e background ne ade bon say no ohye
die.
Ne ade nti bon say ne nkomodie ne ntade hye mu nyina ye se bia afi na owo
yeah guy says after bibi won ho afa na aba ni so fe na obe show.
Ti be me bia so I said this and the woman was like, doctor, it's true. And so here Oma obi a waware na year 60 years obema no 65 years na 70 years na bia oba no se bi nyame aton safre no papa no wakwanya no ware bi wo so be ware obi a oye very younger so washa obema bia owo age 60 years 65 years se bi nyame ton safre na year na onya akwanya no ware bi wo ware younger mako na bia ofa ne age mate anokra no obefa de a ben kakra so 70 years abon so be fa bia 60 so at ono na just on pen ho asem ba koye obi asem bi yenum bi say ya won say 60 years na year 45 years ti be me bia anyi a
state baba beto kwan no
be me bia anyi a ohun ne ho say
guy
but emma 35 years oba 35 years we so critical so analytical ade bia woni ne ye no obebusa asade we mfa so be na de beba. That is period 5 for no. So what I say. So that's another point in here.
Responsibilities in a good pump. Yo, Uncle first started to questions, but me per se, the other no kind if adults be what me per se would share over 30 minutes at the share so na me more 1 hour no moon to me bisa more questions.
So you can chakras no ho asem. Na chakras no yakase ye honam akwa wonfa wani enhu na enso edi dwuma Maame Grace me wa hey betimi akase we na wo ye me chakras say because o na wo busa me questions na me yi ano so sa na ye chakras no ye na dwuma chakras no said de tie no osi ye glands ne so endocrinal glands ne so almost omo dwuma ye so sensitive and so important yentimi enyi yen glands enfi ya brabom ana say yentimi enyi wo mu nsi nchen wa bra ya brabom be wie peye
I want to downloads me
bibia so ho omakoye say wo deep freezer na wo de wo nam egum deep freezer no say ma light off nam na egum no be den e be say nti chakras no ne sana ne betimi a kiremu ama amanfo ate no na say wo hwe ye nuanom omo ye photographers so hoyi there's a photographer and a photography called Gillian photography. Oh yes, Gillian photography na say what you say you take isa image na you were some magnetic field. Your friend no aura. Meaning say what I know
aura,
yes, I know you know aura. So in metaphysics medicine or metaphysical medicine, we call it biofield. To say the biodata, within age, baby, our fee, sign and nipa, so yet ye was a biofield, no, the body aura. So the body aura, no, or no, most of the negativities, no, or absorb it, So, say body aura, no, ebe ye shrinkage. That is where your energy centers also get suffered. So, share table so the illustrations be aba. And then remember be the holy book, that's the Bible. Genesis chapter Revelation chapter 11 verse 15 to 19. Okay. So the Bible has never me be a kaya. Right. Okay.
But when I know you're Roman for the.
All right. No, Revelation is the last.
Hey, unim.
Hey. Okay, so Revelation chapter 11. Okay, so 11 verse 15. Okay. So then the seventh angel sounded, and there were loud voices in heaven, saying, the kingdom of this world have become the kingdoms of our Lord and his Christ, and he shall reign forever and ever. And the 24 elders who sat before God on their thrones fell on their faces and worshiped God. Hana me besi ya, but ebia metwa so etwe. Maybe me depa and the first verse, no, and then the seventh angel sounded the trumpets. Uni ni pakra o kan same way. John enya sa eniswade huni. Na me debia me ka say esuafo no ne Jesus Christ, they were the anatomists and the physiologists. Omo ye obi a omo suesua ya enipa honam mu ene won akwa ene won dwuma a odie. Enti saa da yesu we ana saa eniswade hunu ye a John ehu ye no. O say na the seventh trumpet sounded. The seventh trumpet, it's the crown chakra. Enti se wo hwe mebo Killian photography. Wo hwe sa wo the photography no ehwe oni pedua mu a. This is how the chakras look like. I'm great. It is a funnel yi. Na yeti so de no esi so sei. Na yase so de no so eno so eba ehwe form sei. Enti eno na epeke edi yehwe grounds baby ya na yesoro de no so eteki the atmosphere, normal energy to be a atmosphere be a. Enti also the seventh trumpet. Me who said the American trumpet cry with three mu. Totrobento and son a boy no. The year mutai dina or more aka day started ekotokotoye. No more and penny 4 9 the 24 elders. 24 elders, and your man winning away any podium. You see, we have the 12 meridian centers, which probably you are aware.
I'm not aware.
12 meridian centers. And also, almost say yen blood vessels, almost say yen nervous pleasures, almost say yen arteries. Omunyina ebuayen na connected into our organs. Etimima ye juma. Ye ho ye din ye anytime obia adie bi be ko ebe charge ebe ye double. So what I say and it's our 12 meridian centers no say utimi e build o chakras ni nyina na ukodu sa o crown chakra ho na eno so activate na obehu se de wote obehu se de wa hoden ne power wo a sa 12 meridian centers no ebeye doubled na ebeye 24 anu beye din na utimi be gina brane e wa bra yare entimi ndi wo so wo entimi ndi wo so. That is why Christ was able to defeat death. nti saa na tie nti saa 12 meridian centers no na say areas no and na be 24 and na from the 24 elders a yes omo wo asoro ahemem a omo koto ni nyinaa ye nipadua a eboa yen ama yenya ahoden ama ebetimi adi yare so ebetimi sabi ebetimi adi owuwo so na saa chakras yi
Dr. Mpacho, you are watching the biggest and the largest. People are complaining about the sound too much. Please, you guys should check. Dr. Mpacho to us.
right. So the one under the sacra say na no so tie efesi ebie sei nti enim ni akire saa me the different colors na buy or try Friday or try green nti colors and na taze blue eni nti ni nya colors esisi musa nti no say wo de no emo a na che say block it
circulation nko
that exactly nti organ bia eye under nti yemfa ne say wo crown de no a close so obenya nervous problems obenya nervous problems strokes Alzheimer's dementias forgetfulness all that's it.
You are watching the biggest and the largest. Abusuya, you started questions na say and then yanya ne day. I work at Jennifer. Say, Mommy Grace, please, the sound is okay, pa. They should check their phones. Yes, say the sound is okay, pa. Or someone check one phone. No, mama and you be a action with you. Aye, Bernard and then brush. Just go to obi so chira mo said amonya no wampa mo chomonya ne saa na fedie yen compacho obi chira comment bi but I think I've lost the name but nipa no wo ho a obehu opese won kan kire yen about said any effect wo say wo tie or say womb but I feel he wants to say tubes
Right.
because omo pese omo be wo a aya obi mo tie ebi mu so omo twa
Right.
na omo atai obi say side effect bi
right. So we call it a tiba ligation. No, there's no effect on your tiba ligation. To be honest with ourselves, yen emba reproductive organ. The jumedi obedi ya and say obewo faba. So what I say. And after some time, ne ho nse den hia bio. So that's why we have a procedure called TAH, total abdominal hysterectomy. Yebeyi or tubes. And I say yebeyi yet we take from the tube to the uterus if you want mom. Na why fine. Yeja ovaries.
Na no krebe na wom say uyi womb ni free one ma you can escape a lot of sicknesses. No krebe na wo.
Okay, fine. Look, it's a gland. Okay? So the gland has their optimum function to a certain age. Nti yemfa say wow wo hoi. Unyen do 60 years. Ukoye TAH obeha ho kakra because eye glands no. Ono so obe pese ode hormones bi befra umoja no na atimi akọ nneoma akọyi amount. But when timi antwen na wakoyi afio. So wudi 60 years sometimes they are not glands na adwuma e oye no na say endocrine no. Na adwuma e oye no ehun hye da ehia bebre. They say the medical can say oba reproductive organs. Na adwumadi a odia ne say sebi obebu nsa na wafa yefunu. So after 55 years, 60 years, what is the menopause no? The adwumadi ne enhye da anye so sharp, so active ebetimi enya negative impact ewo wapomuden so. Nti we okay. But less than that age no ukoyi utimi nya some physical effects.
Now, okay, then let me come straight to where you used the female no the examples no. So obi crown there na a block here. Niyama wo kan yi na etumi si na brabo so arrhythmias ne de keke ka ho. So obi so ni root we ne na no so a block here. Na no so wo niyama de beba no so. How do you clean it?
Exactly, very good question. Good. Me endocrine can me late kakra because about 3-4 no. That was the kind of work I made because me obi ba ya me in the centers I mean who say blockages bebre aba. me maame emra na me maame te ase o se kwabran oni obi a ye bibia ye kwasea ewo mu so what you say na ese kwasea ni ti a na agregu yes sa nneoma ya ye ka ho asem eye the energy centers ya ye ka ho asem yi eye suban ye ne ye na ema ne block eno anso na ema ne bie except traumas ebia wenya ka kwanhyia bi ana obi de ade abɔ ebia chakra no wo
you can use rape and all that
those things when your traumas near there and a bit to me yes I'm happy you using the rape aspect because I know bit to me I blockade or root chakra and the sacral chakra no you know so however say yes animal will be and at all and as a blockade yen suban and ye ne a bit to me I'm an engine aba back who you be a sabi where or thymus and our heart chakra a block here. I was say we start a jai and new memu. I was say we start a jai new memu. Within your match. For instance, me in your case be a or see your ma wayama ni fear for and then a busi and then a man
gratefulness.
Yes. And you know why not dream say on ye unim says to say young guy. Undo 40 years, 38 years, unim so onya cardiomegaly. Cardiomegaly is heart enlargement.
Pain no.
Yes.
And to me a year man uncle. No so it's now I be cause you are watching the biggest and the largest. Say and is there a way? Okay, let me put it straight like this. This thing now wokano say chakras now are blocking any sanyama. I personally I have a way of dealing with traumas for people.
Right.
And chakras, heart issues, fibroids, and all that. I have special protein powders, supplements in here. The people use it and it works for them.
Right.
It has got nothing to do with orthodox medicine anyways.
Right.
So me person me who say wire doctor no combining it with nutrition. Say I know na approach the doctors ni na nutrition aye issues but I had but some of them are coming out of it. Though learning it is not easy, mom. But who doctor no me say wo de cardia make ho. Say ye lack lot of minerals and nutrition in us as Africans. We don't supplement. And when we are eating, we don't eat balance. And that's it. Benkuni okru, and that's it. We don't actually balance the diet we use, and it also causes a whole lot of and also causes blockage apart from these traumas and all that.
Exactly.
So that's what I'm saying. That I have a way of detoxing the body and all that with herbs. Me orthodox medicine anyways. So me person me wire doctor no de ka ho. Sa niyama we ni nyina no. If somebody's chakra is blocked, ebi kura na wa ma asem no ko jama ne ka de obi ajama ne ko ba if you think there we exactly. What can people do to unblock it?
Okay, so their plants, their herbs, their roots. Okay, kaboma etimi boa ema o chakras no etimi ebi. So ya be in supplement. Said the woka say one kasakra will be there's no doubt about plant medicine. And we are hodwa yetimi ede ebi chakras. Into washa ye na nano no mo say dudo. And when you say uncle for ebi wa brucha, he was able to tell me say na omo ehye enwura ewo yawa mu ye de so what I say enti ennuane bi bebree ehambaba ne bi bebree wo ho a the moment a ebekọ omu no etimi eboa ebiebie ema chakras no etimi eye adwuma yie kama ebi nso wo ho a eblock no kra ennua bi wo ho wonim na okeka bom na wo de ya etimi kra say chakras no enko anti it takes knowledge, it takes someone who has been trained to say the training ya yama nyoma ya odi eye nti nnuane de bebree ho supplement bebree ho a ye de ma ebi chakras nti nya se bia unless odi asem na kwache nipa no wakopa na che oni ade nti da bi I mean, I block
Aya wo ya.
Ayo ya. Enti ye ho therapies. Wo fa ho nro. Wo ye ho exercise. Wo ye ho akwankyere ne ade. Ne nyina betimi aboa.
You are watching the biggest and the largest. No bibisa. Say there all my supplements are now in Ghana. Mrs. Tutu Adaromo say your opinion. In fact, wa brochi ni wa Ghana. Any product I will be say nature fortune media. And then they matter to a mom. Me create me demand crofo to say doctor say awaba he. Na me share na se metumi na a business me create na ma create wo ni din. Na me de amano but nature fortune no we are building people so wadwene mu ene wakoma mu ya ye ne wo ya ade ti when wo abrocho wo a ho nature fortune and fortune will be ho a wo copper wo essential oils ni nyina na nature fortune ho a they are my creation from
yes, so that reminds me other essential oils also be ABA chakras no
eno de enko ho
oh yenko fa
da bia no be to say ye bo advert amami ntu de ye nje no say let me open the phone lines na owo nkasa because myself I don't advertise anything I do on my shows.
Essential oils are very very good for chakras.
Essential oils, yes, they don't know the difference. Ebusia me say me video amamo, they don't know the difference. The one with chemical na they are hwi nimu a wo de kogu we asuma e okay ba wo de ba ko na chemical wo mu no udi gu eni a aya Africa say ye we echi kakra when it comes to those things ba nyame adom kakra no ye bedu obi say die be nyame na meka nyame bia nyame adom you are watching the biggest and the largest into so obi tie ni womb na ensure that any problem because yo abusia ye we need best editorial makeup artist me makeup artist you now at the part and no winning we are always at the winning side when winning award no hands down and according award number if I'm the beba Sunday na me dey abekire mu nyina wa hana machine so we keep winning so doctor me pa wucho wo me bebie phone lines ne na amanfo ebisa wo questions obi say gifty owusu manu or say I am 41 I am 41 my period come small and last for 3 days. Is it a sickness?
It's okay. 3 days is okay.
Ayo, so 41 there. What call the other column?
On the 6th period.
Yes, what was this period? So mbabiom kura, yes say mbabiom dey enya won. Na say na 35 na go chicha.
No, so 41 is mbabio enye
problem.
And said that big issue, but at least in Kawonya 50 years.
Oh, challenge. Bibi wa obeye, obi abeye no wenya 50. Because say 28, 38 krema.
Yes. Say anypan ebia ono onya problem say na so ebia na opeba. On say wonya o mensisi year e be difficult say obewo.
Nti wo peba na eba ne sa na wo ye worried. Nti obeye den.
Oh, onhu ne guy ni.
Ohun ne guy ni.
No
mo so aduro ngu ni mu.
Oh no, nya bibia na e come na aduro sa.
Obeka so onu muso mo.
Oh Debbie.
Say
investigations e be sha the ebia there's some growth tumor something or hormonal imbalance
hormonal imbalance ne ade check your diet and lose weight. Lose the midsection. Obi bisa say BP no curable. And I said the other day we arguing. Said BP no, who said diabetes? I said I refuse. I disagree.
Good.
Obi bisa said diabetes ni BP no way is curable.
Yes. So which one do we start first?
Anyone. I tell all the bomu together. Nipadi didn't cry. I've missed it. Just that when I capture it in my head.
Yeah. Hypertension has two folds. So we have the essential hypertension and the non-essential hypertension. So with the non-essential hypertension is the one related to the organs. And say when you're cardiomegaly, wakuma hono. You say arterial problem or arteries. Aye den arteriosclerosis. Sane manemanya or kidneys. Na ho den or form or fatty liver. Sane ma when you able contribute ama or pressure acostro. And no, if you are able to solve the underlying factors na, BP no ebitimi aye stable, unfedro, crabio. Now with the essential hypertension, it's manageable. So essential hypertension got to do with the discussions here, with the chakras. Yes, and yes. So essential hypertension is we won't say nipa no ne ne bibia ye fine. Obeye lab investigation ne bibia fine. Yet pressure no abnormal. Nti I was say deep into the chakra systems to know which one is causing
the problem and balance it.
So when you balance it, then the BP will.
But I know that when you eat clean, exercise, and sleep well, like you get 8 hours, it also helps it in a way.
Yes, so that's what I'm saying. If it's an essential into your lifestyle, so let me put it that way.
Lifestyle is the word.
Let me put it that way.
And also to me, correct.
So if yours is perpetuated by your lifestyles, not modify. In fact, BP and also hypertension and kasano. So we have a modifiable states and non-modifiable states. So what you're saying, the ones that you can modify, that's your lifestyles. Said so what I say, ebia umu aye do bebre. Ebia all these things are modifiable lifestyles are obetimi aye hu bibia ebetimi ma BP na jai. Obi kwa ho oye adwuma more than 12 hours. You know no on that say onya modify otimi 8 hours. Onya 9 hours sleeping no odidi ye said ye work no na already abon say BP no de bia edadi. Now the non-modifiable ones no and I say conditions no age obi a wunyi na obi picostra I mean wunyi age untimi ka say wage no
so bibia decline you know and why would it
good I feel genetic if hypertension has been identified to run through our genes and our family. So if you have a positive family history of hypertension, Maame, papa, that's your direct blood. Hypertension na untimi enkase when you binti uno utu ase eno non-modifiable. So what I say. And this
no like say be wo ufia
yes.
No when you be untumi into ase. Me I disagree.
Okay, so I know your non-modifiable factor. Now your gender aspect. Unim say me nya hypertension same ma.
I dey come prostate no.
Mema nti age and so non-modifiable. Nti to say we say you are fortunate to be exposed to a lot of things. And with the gene aspect, probably you could work.
I know the age. I do all the tests and know the age of my genes and all
good. And then you are able to probably reverse some of the genetic deformities, and then you are good to go.
Very true.
However, most of the cases are what direct positive history of hypertension. Any panel a difficult say or reverse to say counseling, drugs, medications, and those obviously I'm a mental anchor drugs. And see, with medications and other things, we'll be able to. And it's all about management. And before I'm better, condition be I mean the person was just paralyzing. Or by the pressure was 170 over 106.
Somebody is asking a question like that here. When we say right now, no, people are having serious issue with their vagus nerves, but they don't know.
Right.
We say no, so na efi akumanim na any akuma efi yefunu na ba efi adwene any way no, and they heart attack any strokes ni ade and so they brain crofo. So obi say obi a crofo nimu nyina omu nya serious knee pains, and I think it's a sign of heart attack or something. What do you have to say about this?
Right. So if you're having knee pain, it got nothing to do with your heart.
Doctor.
Yes.
If someone is getting knee pain, the person is not having any. Maybe some really question him out direct.
Okay.
Or see, please. Most people I know are suffering from pains in the legs. Okay. Any reason or remedies?
Right. So it depends on the type of the leg pain the person is having. So if it's a sciatic nerve pain, then so obviously
not to the bum.
Yeah, from the buttocks down to the limbs. And also it affects you more. So back to your statement.
My statement, let me put it well. So you were able to address it well for me. Because when you do nutrition, it's a little bit different from yours, but I don't know a cut across a camode and munim better.
But say you have to do basic medicine before
That's what I'm saying.
go and do.
And we know that when you have clogged arteries, and I say, arrhythmias, and you are not able to pump more blood into your system.
Arrhythmia is just a wobbling of your heartbeat.
Heartbeat. That's what you are not pumping more blood into
adequate blood
for circulation. Yes. And you are getting problems. Yes. Your knee is part, your shoulder is part. Is your knee not part of it and your shoulder not part of it?
Good. So now, the knee...
What are the 7 serious signs of heart attack?
Okay, so chest pain.
Is shoulder not part? Is the knee not part? So that is
the shoulder that you are having. There's a condition. A bit me when shoulder pain. So what I say. So cardiomegaly sometimes presents because it's a referred pain. Heart problems, Ansah, sometimes it's a referred. The pains are referred. So it goes to your shoulders, then it comes to your neck, and then there. So we call them anginas, angina pectoris. So we have the stable angina and then non-stable angina. Good. So those are all heart problems. However, your knee has a tendons and cartilages. Okay. So if you're having a knee problem, then it could be an arthritis and inflammations in those ligaments now, either the tendon or that ligament. So these two structures a bit to me are. But if your pain is up here, your shoulders, your neck, the back, then it could be the heart problem, which is the angina pectoris that we normally diagnose.
Maybe I don't want us to divert, so we will leave that part. You are watching The Biggest and the Largest, and I'm going to open the phone lines. But let me address this. We are not talking about my website, but 3 things in a Uber office no yedi abagana Mrs. Tutu adarom or say emfa bimbra no obi anya bi. It's about dealing with your weight, the midsection actually. Obia person ye funya flat. Na obia nso nim ne enti a wuyinya na wo ye funya kese. Can you address this for us?
So it's a syndrome. We call it a Cushing syndrome.
When you are growing and your tummy is becoming big. Why does the body itself store fat in the midsection?
Okay, so it is not only fats that stores in your midsection. Most of the ensure that is the fluid in the most of them now are accumulated in your trunk, especially when you are growing. Yes. So old age comes with a disease called Cushing syndrome. So it makes you accumulate more fluid in your bellies and then your trunks. Into one say, most of the time, it's caused by sedentary lifestyle. So when you say sedentary lifestyle, you eat, you sit in your car. I mean, you don't actually do more of the movable things. Then it causes the body to retain more fluid in that segment. And since one person benyasa issue now, then you should be working more. You should be doing more active work. Then you'll be able to stay away from that kind of signs and IFR and Cushing syndrome.
You are watching The Biggest. Okay, so we learned and millennia or no learning the book, no learning about some count. Me learning my book, no learning my base some account. So from my own downloads, the body, the organs, they are so intelligent. They know that when they store fat or fluid, it will cause the body. So they themselves, they push all the fat and fluid into the midsection. They don't want to store fat and oil. When it is over, that is where it gets into the heart, the kidneys, and blah, blah, blah. Everybody wants to have a flat tummy. But if you stop or you tie the tummy from becoming fat, where would the fat go? Are you pushing it into your heart? So there are supplements that we give you detox first, remove nyama nyama, the fluid, and then we put you on a particular aduane and then a particular supplement. So, because lack of vitamins also can cause a whole lot of vitamins nakasa imbalance here. So please, so that is what we do in the office. Everything we call on my to grace get one over and obe handle fe. Pacho mo bi amfa pressure mesi mi so misremo. Me bo ma bere waka makama. Ma membo. Nti say ye be phone lines na my doctor no mo bisa no questions. Hey, say you 1 hour to go into like I promise no. Doctor please can tree why? And I saw the tree ni frefra na. And I will the over of no cram the any. Sophia Marian Amwa, or say you are, or say yes, our estrogen protects a woman from some conditions like the yes, cardiovascular.
Yeah.
My mom sometimes experiences numbness in her fingertip, at her fingertip. Please, what causes that? What causes that? And if there is remedy?
Yes.
I had a natural remedy.
It's numbness. So if it's numbness, and also into old age. Yes, Yes, I was impressed when you mentioned the vagus nerve. So the vagus nerve is one of the cranial nerves. The cranial nerves are 12. You see, we mentioned the 24 elders. Good. So there are 12 cranial nerves. That is also working harder, like and one of the biggest one is the vagus one. Ebwa ma yakuma, and then most of the circulations edi more akutne. And it's a problem. When you stroke, some of these nerves be and are affected. So if you have so the oculomotor nerve, which is the ones that makes you see, it makes your eyes to so that's the oculomotor nerve. So then we have the trigeminal nerves. The trigeminal nerves, supplies our lips and then the tongue. Exactly. And all these things, so hypoglossal nerves, your throat near the all these things, now chakras affected, especially with the crown chakras now. See, saa mpanyinfoɔ aduonu ɛnan yi mu a Bible ka ho asɛm a yɛde efi sɛ ɛyɛ mpanyinfoɔ bi a wɔn koto sɔre nyankopɔn bi a ɔte baabi no so ho ɛyɛ saa nerves yi nti sɛ chakras no yɛ adwuma yie na wɔn yɛ activated a saa nerves no wɔn bɛ charge wɔn bɛ nya ahoɔden yie more ɛma sɛ stroke sɛ anwudwuɛ this numbness ne saa deɛ ne nyinaa nya adeɛ a obetimi enya saa
mo de mo maame nom no mo nyinya mo mboa mo no mo nye active efie hɔ nom no garden kakra na ɛwɔ ogege ne so a na o ye na on tena ne to so
supplement with vitamin B12.
Supplement.
Yeah, B12. B12 is the food for the numbness for the nerves. Yeah, and
you are watching the biggest and the largest. Okay, so Nana I'll click or say greetings from Liberia. We are the biggest and the largest. Oh yes, we are the strongest. Ado Rexford or say watching live from Saudi Arabia. Hey, Mokwan wow, every Ghanaian live everywhere. Which why? Jimmy say BBI fine. Dr. Bernard. Hey, Dr. Bernard, how are you? Can stem cells from placenta be used to reverse or treat old age conditions? That is anti-aging.
Right. So stem cell has been it has come and it came to stay. A lot of work has been done on the stem cells, and then it's actually doing work. For me, there was one product that they said it was stem cells, which I followed. So stem cell has come to stay, and it's actually helping to reverse most of the old age.
Now we have a stem cell, we have NAD plus and all that. Stem cell is very good. But me, I feel whole meal is everything. Like I'm not saying I don't believe in stem cell. I think they are quite expensive.
No,
stem cell and NAD plus.
The one who brought the father of medicine told us something. He said, let your food be your medicine and your medicine be your food. How do you understand this?
Hey, one more the phone line to one and Crawford starting free.
So, or say, let your food be your medicine and your medicine be your food. In other words, aduane a wo di no, who say, mfa so de na de bro say eye duro. Nti ma aduane nyina anya te say duro. So what you say? Ma what duro nyina so te say aduane. Yes. Nti I mean I agree with you.
Okay, since you have the lines and you are already calling, maybe ama mo na mo bisa no questions. Say the me the questions asa. Eh, asemo Abdul Osman. Eh, the volume you be say yo na mo wa hi na mo di yellow e. Ala mo Babylon ana. Abusia. Please, airtime. Please, at times my heart beats very fast. Please, sometimes my heart beats very fast if I lay down. Please, what can cause that?
So
Palpitations are now.
No, that's called tachycardia. So tachycardia is abnormal fast beat of the heart.
Tachycardia faster, bradycardia lower. I'm learning, no, I'm learning.
Yes.
So, okay.
I will say, to me, assess my who had the crime, I manage tachycardia. Oda, no, be boprum, no, nenity, and the emotion and a and see, these are some of the early signs of hypertension, high blood pressure. It's in Panicho,
on checking. Machine 470 to BB. Just buy one. My officer to say hospital room, me check me who's there.
It's important.
I want to be wearing my shoes. You are watching the biggest and the largest. Please call and ask your questions. Blessing Ella, or say watching from Finland. Can you please ask the doctor how I can help my child who has been diagnosed of epilepsy? Is there any natural way? Do you remember the other day where I said when you come, we'll talk about it?
Yeah.
Any natural remedies?
Okay. So epilepsy has not been, allowed to manage from home. However, there are very effective medication at the hospital. Or
also may use natural remedies like Fanuco Hospital.
Yes. They are very effective medication every day, just one tablet will keep the seizure stopped and the child could go through all his life.
Abusia, Fanuco why? Hospital media me GBBO, me try me pamahuto. Me just static at one place. Me operating with dogma.
And that is good.
Inti Fanuco now monshano. Now would the shilajin account now would titimano now no why? Shilajin is very, very good. They do a crowd the shilajin. Would him said they are mixing with the goose 2 weeks, both are starting 50. Shilajin is very powerful, very, very, very powerful. And when I medical add that supplement to human crop for Ombano, I know when you saw a kaka say autism, nye. They are great improvement.
That's good.
A hospital, major hospital, to me the Obano Ako Hospital. People are calling. John Chum, or say, please, I'm 26 years and my period. Now we have brought John Chum now we period. John Chum.
But maybe I join a Chum.
John. I John so meaning some school news and I John the name JOHN. John, women's station back here why? John Chum, say, please, I'm 26 years and my period comes only 3 days maximum. Any remedy, please?
Yeah, it's normal. 3 days. Let's say a back camera or son of twice a day. Normal. But o make sure say 3 days, obviously, now they are one in many every year. It's about 2 days are abnormal, but 3 days menstrual flow, it's accepted.
Okay.
Yes.
Where you K.A. Simon and Simon, or say I don't miss video, but I never watch live. I'm be lifted today. My great wish is to meet Maame Grace one day. So be it. So be it. Odo nkwa odo nkwa. Yeah, ade. Oba ebe gba mpese ni atwumeko. Na ye de atwa ye num. Why? Anytime I pese oba na waba. Akosua eja akosua agimandua. Akosua agimandua. Monday de na me no nko an ye wo ayi ni so the first people na who started shouting you are the biggest. Na me to me nchuro bi nti na me ho na me chia o. My love to you. Why? Akosua. Or say please, any remedy for angina, low oxygen in the blood. That thing is now rampant.
That's a very good question. That's a very good question.
That thing is rampant now.
Yes. So angina comes with you have to do your investigations. You need to take scan or a CT or ECG. So we do our ECG to know, the heart has chambers. Good. So we need to be able to ascertain
where the problem is coming from.
Exactly. So there's angina. However, you need to know where you have the problem, whether the ventricles, whether the atriums, whether the septums, or the valves. Yeah, so the valves normally comes with the arrhythmia. If you have the valves incompetence, that is where you have the arrhythmias. Inti akosia na your friend is saying.
Akosia.
Good. Inti oma yenye ECG no yentwa yebetimi ehun. Ocha obetimi the amount ama we ready and now obetimi the ascend me.
Me reading it the menya
or the Bible. So be ready na yehu. I've had couple of them. Emra ye we no kofu bebre dey omo investigation reports ascend the obi say send the heart left no ahono eso obi dey ayekese kakra obi dey amoa na ade nti ni nyina no laboratory investigations and the diagnose angina send be ya e be hu medications are e dey nipa na beto so. Yeah.
Okay, this is Azalu Felix. Mommy, please ask a person can ask the doctor. The ladies who the ladies who normally takes pregnant preventive pills, what's the implications? Do you want to talk about this? I know a little bit difficult to talk about.
Oh yeah, it's fine.
Okay,
it's fine
then
to talk
please
about
answer.
So they are hormones. Okay, so also the emergency contraceptives and I say. Like, is it emergency or the
family planning?
Family planning.
Yeah.
Good. So family planning it's good to talk about because say person obeying insane. Yes, into person obeying insane. Now the hormones are working in their IQ, in their own IQ. Now the tablets or the substance that you've taken, akwache hormone say me man nye sa adwuma ni bio. To say ye nuanom ase bi omofa enyoman obi oha obefa haban bi obe smoky na amana aye wa high enesa nti sa na ade nyina ate nti so women who don't want to get pregnant will take a pill to distort the IQ of the hormones. Okay,
he's asking about complications. That's what he's asking.
That's what he's asking.
Yes.
Yeah, so complications comes even water. Complication will be beer. You just have to be ready to deal with it. And the own person obenyemwa wanya wafa o contraceptives and now why your family planning. I mean, we are ready so person onyemwa ube jai 2 years most of the time when they are aware. We tell them say look I drew a day ma no o menses no emba ye na ujai nso a it may take you 1 year or 2 years for you to have a reset. Now they are not omunye abutra omode be twensa na ya na omukoko baby omumema sa complaints no because obie no a man of family planning protocol yemfa ne mfa nchechire mu.
Into there is no complications. Is that what you are saying?
There is, but we deal with it. We deal with it.
The question he's asking. He wants to know whether there are
so there's a complication, but we deal with the complications. Yes.
Okay. Yo, obisu di eni o. Ekaya properties. Ekaya properties. Hey. Also, please, my question is that my husband have been experiencing weakness all over the body with numbness, numb fingers. I think the question someone asked.
Right.
When he wakes up from bed, what could be the cause? When just a
yes, just a lab, a hospital. Now, I mean, age and so here. I will say, the circulatory system. See, there are 12 systems are ejuma and 11 systems are ejuma. And system be ho here. And especially with the nervous system no yet yebetimi ayemu yebetimi atwa CT scan ewo ne timu amie hu say owo lesions bi ewo nerves ni mu I mean sickness bi enkoyie synapses bi enkoyie ewo nerves ni mu a yebetimi yes yebetimi hu na ya boy ni
wait so you be so question Osi, please, is there any remedy for delayed speech in toddlers?
Good. Yes, because I talk about the 7 years or the 7 periods. Yeah, I know this question is gonna come. Yeah, so there's a therapy for delayed speech. However, mema na train about 7 years. Yes, non-delays after 7 years, utiye ya etimiba. But there's a management. There's a Kolebu center, omo sa center na omo manage delayed speech in Kwala. Yes, sometimes we say eduane kra no. So where so be our fasa area na eduane wo ha ye de man Kwala na omo ye nti
ada me who said adeko e cause fibroid me re ho pa. You see this simple thing.
Yes. Nti akola na ontimi nkasa no onyi situ eduane bi amfi na eduane.
I keep telling them.
Yes, only process foods bia amfi
na
eduane. Yes, kasa na beba na fi omano natural food onye vegetables omani di vegetables bebre ni
omani associated with people.
Exactly. I mean speech in beba.
You are watching the biggest and the largest. Regina Sapon say love and hate. Oh, love. As for love, we love. We don't have time for hatred. Hey, Ubini, Kujo wheat. Hey, are you wheat? Please, ma'am, can you ask doctor something pain in my chest and my shoulder?
Right.
What can we? I think we spoke about it.
Yes, so it depends on the particular chest, particular
the chest.
shoulder.
When it is right, what is it? When it is left, what is it?
Great, very good question. Yeah, so you see, the as you are facing me, there's a 2 folds of circulation. Ekoso, yeni peduem. Nti wo facing me say no. Obonkum so circulations na nyina circulation eko organs and perfuse organs no moja na eko no ahodi wom. That's oxygenated blood which is going through your brain. Some are going through your breast.
That is the left side.
That's the left side.
Okay.
Good. And then the right side, yes, has also gone to the lungs. To say left na the core no organs na ko use ni nyina nti asan ba nti ebe ba befa left right heart na akọ lungs na akọje oxygenated. Good. So depending on where you have the heart problem, that is where you're going to have the pain.
The experiences.
Yes. And then yeah, chest pains ni nyina so na related to heart. Some are lungs problem. Yet if you have a tumor, if you have a calcified lungs, you could have a chest pain. Even peptic ulcer disease could make you suffer, chest pain. GERD, gastroesophageal reflux, a bit more chest pains. Some of the chest pains in the baby or heart.
What of the diaphragm? Does it also sometimes cause the
yes, so diaphragm is fantastic. You know something?
Because I know when you pull the air,
right. So there's a condition called hiatal hernia. Hiatal hernia. That is whereby your stomach has actually pushed into the diaphragm. Yes, and also to me, chest pain. So if you have problem with that side, and also
this question is big, but I will still ask you.
Right.
Ambitious Efia or say, Mommy Grace, please ask doctor if sickle cell is curable.
There's no anything that got to do with your DNA. It's not curable.
Efia Sawati, Kwame, Kwame, KW star M3. And the aeroplane and I want to social media minimum. Quick question. I had a male friend who started having an intercourse with 17-year-old. What can be the implications? He keep doing the Lord's work, the biggest.
I see. So 17 years. So onya problem ne dia say ne
onya na so be so
oh onya dia
onjaye
na
onye be 3 bi nka ho
oh
asa
onjaye cry na onya from 21 years ago
the last one oh na nka ho
ụmụ
onya 3 bi nka ho
na fi on try say obese ne ho den
abusia ye say ne we njaye de ne de ba Emilia Akoto I was told by a doctor every most black women have fibroid. How true is that? How can one prevent fibroid the natural way? I'm the best. As for fibroids.
If you want to prevent fibroid, just give birth. Just get pregnant.
Na eno de wo ho say nipa mbedem no onyini ana mebo anti empty. But still there are supplements they can do and everything will be fine. Because when they remove it comes back.
That is when the person has fibroid now. Yes. Anti obehia omoa.
There's that one there.
Onya idea onwo na onye free.
Unya wo betumi a wo untumi wo a. Try this thing, magnesium back to back with other supplements. It will help. Ment na one ye obewa wo wi later na wa hwe aware na se.
That's it. No waka.
Metumi enya asem nana yaw oduro. Or say please ask doctor, I was told salt can be used to heal high blood pressure and stroke. If yes, how do you do it? Doctor, you don't come with you anyway. Yeah.
No. I bet to differ. That kind of question. So there are a lot of propagandas which is going on with the salt treatment. Fine, salt is doing wonders. However, you need the qualified person to do that therapy for you. So because it's a TV, people are watching, who don't want to show that, go use this amount of salt to go in.
It wouldn't even make sense. Yes. Because the salt until you have your lab results and all that, how do you actually prescribe now the vitamins we need to know where you are not balanced, then we balance it. So I know the anyadi will be able to and your uncle. Dr. Bernard Yabua, in America and other Western countries, children are being given transgender remedies as young as 10 years old, sometimes without parental consent, and long-term effects on the chakra and hormonal imbalance. Nyama de say nyama de nkrofo ye bio. Ohwa na motene de yesi. Queen Posh or say, Mommy, please, is there a problem with a lady in her late 20s? Hey, Brofono, get her period in every 2 months, but flows 7 days. Just
yes, anemia, you should check the blood level. Yeah, onko checking the blood level. So if you're anemic, we message on emba every month because the body has an IQ, in the sense that say what umoja ni sa bosumi we on my own flow obetwen say ubenya 10 or 11 grams per deciliter and Ansah ube flow in timpancho more than so bekwa kohwe ne moja do na onye ni yi afi bosumi bia ebeba
sa we na mo chro no de ya na but maybe sa no so we have to answer questions nti or say me mama bisa two we abom. Doctor, please, how can prostate issues be prevented? And I want to know if genetics play a role in it. That
yes,
is
the first question. The last question.
That is prostate.
Is that the last question?
One in
okay.
I work at Jennifer Sema Grace. Please ask him, is there any remedy to cure ulcer for a 10-year-old girl?
Right. Okay. Right. So let me deal with the ulcer 10-year-old. So there's a cure. There's a cure for peptic ulcer diseases, depending on the type of the ulcer. Maame, you see, there's an organism called H. pylori. That's the Helicobacter pylori, which is infectious through saliva. That's a saliva person-to-person contact. If a child is onibi, na maame no will be, or the bottle water shenano, na bi wo maame ne tissue ma o de shabo fana na obenya Yes. So obetimi abofra. So there's an antibiotics. Yeah, the bema abofra obet. I mean, both orthodox and herbal or a cure.
Okay.
And you know the also the any big deal.
Okay.
Prostate question. Prostate has a link with genes. Nti opapa owofa direct blood link say omo prostate issue a link also betimi enya. However, bema, as far as your testicles are concerned, you are about to have prostate enlargement. And there are 2 conditions or 3 conditions when it comes to prostate issues. First one is prostatitis. Second one is BPH, benign prostate hyperplasia. Third one is prostate cancer. They are not the same. Obi betimi anya prostate enlargement, only prostate cancer. Obi wo prostate cancer, only prostate enlargement. Pachotini. Obi wo prostate enlargement, only prostate cancer. Obi wo prostate cancer, but only prostate enlargement. Prostatitis is for younger people. And the prostatitis, and also you're grouping into 2. Specific prostatitis and non-specific prostatitis. With the specific prostatitis, they are caused by bacteria like Johnsomo yare and the endemo yare to say chlamydia. Chlamydia ya boa ope baby a emoja wopa ope vascular and succulent organs. Nti mba say mba nya chlamydia ekọ ma wudie mu because ehọ na aboa ne pe. Be man so nya chlamydia ekọ ne prostate glands mu, ekọ ne epididymis emu. Junsomo yare nso etimi travel to the prostate gland. Na omo nso akọ prostatitis. So what I say, young people, if you are having issues with our prostate, it is either specific, which is caused by bacteria, or non-specific. With the non-specific, sometimes there are allergies. This time, remember, when you say yesra, you use other, white skin products. Sometimes
put steroids.
Oh, I'm common. I am Maame. So steroids gets irritated into the prostate glands, and then it gives you prostatitis.
It's more dangerous.
Yes. And also yes.
You are watching the biggest and the largest questions. No doors. Yeah, baby, Sam, Abosumasu. I mean, ejaculation be one. Ejaculation is something important to me.
It should be. It should be. It should be important to you. It should be important to you, Maame.
K.A. Simon, or say Doctor and Maame Grace, ejaculations that occur in a dream. A dream naka. Because of physical, mama de abana masumahia. Also a dream. We Allah. Ejaculation that occur in a dream when one is about to achieve something in a dream, but not sexual activities are caused by what? Also, that I know who is in so.
So the baby say me how you.
I want to do it.
Question with the who baby say me how you.
But on a more serious note, Some Bema crowd, who honor what the nan, and yes, I a problem.
I'll say sorry.
And I wear for baby some more.
Oh no, say there is some buy.
That is no. So if you are not, none who you know when you'll be a bit imagine now. Already I know. Or the man could do. Or the gas as old, you know, where I don't pardon this. I have ice block to so. Why? Eh? Oh, the ice block to Sarah. You are watching the biggest. Me come cast over cast a week at me. I read the way I'm Ajo Popo. Hey, Ajo Popo. Sorry if I don't mention the name right. Adia Michiani Nipedia Yesino. Sefan Debbie. Hey, Sefan Debbie Mansa. As a man, should you born early than late? That's a great question.
Another tangent.
That's a great question.
Another tangent. Yes, another good tangent. Yes, so as a man, must you born early? Yes, it is yes and no. That is if you really want to grow with your children, yes, then it's very imperative to give birth early. Good. And to say that make kind of third period, 21 from age 21 to 28 or Bema also with me firstborn. Yes. And by the time I'll be 52, now ban so or be 28.
Now when you knew.
Very very good. So Osha, yena nanom no. Yena nanom pa no.
Hey, on na 18 no mo de na man. Obogu.
Yes.
And then na bibie ni wona obi enfa mo machine ni ma o mo laadwe. Elizabeth Annan, my dear. I say, Mommy, please ask if it's advisable for a 42-year-old woman who already can still have more if they want to. Who part of a 42-year-old woman or one bad that no person who become one because I'm so open tempty. One trono.
Yeah, that's another good question too. Yeah. Yes. So depending on the number of children when you and I am sure no or woman spontaneously and I say surgical so man I see as womb. Okay, and to say well woman spontaneous maybe a 4 or 5. No 42 I mean medically I bet me I can say they be on so on jai.
So what two?
Me so 2 fine.
Or 2 no
person be or 2 can one. Okay, the menses no fine. And I warn spontaneous 42 years. He still have 3 years, 5 years. Now or they are count, you know. More than so bad and tempted. Most of the time, no 42 no. It be the last one over 18 years old.
And no na dey pain ni ba na dey problem say ba.
But say nkwala na bobo so a e be 10 6. And over 42 or
betumi awo aka. Na adenti na dey awo 6 dey onu ntumi nwu nka.
Because of the
ade na ebe yi abefie wo area ho no. And Elizabeth ye ne ntabo na fa bibrem na me hwe mo. Me grandchildren, a lot of them. I want grandchildren. No mu nyina omu usu. So we need scout the omu nyina tena konya so obia we ni obia wo hwene obia wa no obia so dey different.
That's an amazing creature.
Yeah. Sure omu nyina ya fesi wo hwe. Sure omu nyina obia we ni obia wo hwene so obia dey different.
Yeah.
So beautiful.
Right.
I love plenty of them. Mommy Grace, please, last question. When does ovulation start after period? Oh, no, just so no be
yes, it's no be but we give a grace period.
And your money.
Okay. So you start counting from your day. So if you have it for 7 days, you have 3 days free period. Then count 7 days. So the 7 days after your 10 days, one of them will be your ovulation day. But yes. So when you the 3 days kind 7 days be count. 7 days near free period. Next kind another 7 days. Most of the time na 14 days, but because you need baby would any be seen the amount of grace periods. Move back.
It's a pattern who cry now they are.
Exactly.
Oh, where do you say or Europe why testing doctor said there's nothing wrong with no. But still, onya pains on the chest. Ombre fie kakra na.
Yeah, ombre fie kakra.
Abroche dey stress wo ho. E ka kire me baby me se mo Ghana na boys ni chase mu a. Na mo so omo ma muska. So won so ko unya bi kura enye.
Yes, I'm kutu.
You are watching the biggest and the largest na so ye kwa abroche. Nana ya woduro o say please last one. What be say bi dey obi so bi say bi. I say kodo esel. I say, I will bring you 52 children. Don't worry. I'll bring them. Hey, cooking for children. Ne diane big. Now and they are making. And they are making noise. Stop it. You are busy. These children. And when you sleep and they are all sleeping around you, it's so glorious. Oh, they should bring them. Oh, they should bring them and worry.
That's right.
Mommy, please, is it safe if you have your period after 30 days or it must be 28 days?
28 days, between 20 days and 35 days is fine.
It's okay. We also 30, there's no problem. Susanna Atta, or say, Mama, please, I am 24 years old and there is something in my stomach. Dr. Mpachotio. And it beats more than my heart.
Good.
and I am afraid it may affect me from giving birth.
Yeah. That's a very good concern. It could be a fibroid.
24?
24.
Okay, now dear, BBI is possible.
My client to be another 19 years. Myoma was like this, huge. Very palpable. Yes, 19 years.
What's happening?
No
be a when you're menopause, so bet me have fibroid.
Say Onya Ansana Ovenya.
Menopause. Hey! And yes, you. But yes. On a more serious note, our body ankasa. Sometimes strange things can grow in the body.
Say, and then I my until I will say, me nyame for being count. We know, any nyame no. Or say, man, yes. Oh, madam. Or say, man, nyame. Until I will say, we now say, or say, know thyself. Know thyself. And to say what to me who ipedue pa year. Now who knew my woman now on sorry in Pierre Bontin and Coffee be before and can dear. Then you become a master of yourself. That is why our Christ came and our master Jesus came to. And in your ma, no can you na medical say Bibia or Bible is about human being. Bibia a Bible from Revelation or from Genesis to Revelation. Bibia hobia nipa yeho. Na just say so you're coding on. So if you're able to decode it, then ebema wo hu nti me bibia ni ho a wo de to ho a mefa anase mepre apart from nipa.
Oh life.
Life menkwa.
This is Emilia Koto doctor. I say, what are some of the supplements that enhance pregnancy among women, and what supplements are good for pregnant women?
Do we have to mention any product name?
Because when we say Obia ne honam,
exactly.
Into mention Obi konomuna
your age.
Your age
matters.
Age is important. Sometimes your blood group
is important. Your hormones, they are all important.
A pregnancy nuclear bosu say.
I also want you that say or
for pregnant women
to take for okay, so that is for the time I want you maybe up a baby a nourishing on folic acid.
And say no one
to prevent spinal bifida.
No one modema.
Me few.
Our Jennifer, Maame Grace, please ask him is because of the blockage chakra, that's why we are getting all these illness.
Another good question. So in Yariwa, there were two groups, so the communicable and the non-communicable disease. So we are talking about the non-communicable disease, which is the lifestyles. We are not saying say why when your problem be now automatically or chakras are blocked. So what I say, but then we are looking beyond, something a bit more solving problems. That is the importance of these discussions. You see, in your chronic conditions, I mean hypertension, diabetes, cancers. Is there anything beyond it? That is what we are looking at it. And we are not saying say, chakras are blocking and a bit me ama wenya and yawa. And yawarum baby or lifestyle bit me when the what normal and sabone yes smoking
juma baby what to say juma boso de bia obu fu uni anije na wusu.
Yes, and we are saying say and your man na won for wani hu na e ma we yare no there's something more to it. Panacho sir nipa na or the question about ontie ni ye. There's something more to it. Say wo fridge yo ho wonnam gumu wo light adwuma enam ne nyina ye fresh kama. Say you do me light na 3 days na ya nso enam na e wo fridge mu no e be start asay. Nti ye ka say
yen kan jiro session nchine ye hwe de obeso fridge na bibia you okay.
Oh sister mama ko why na mapon
wo bon
na say asema wa kan dey say we program yen kan jiro session nam ne nchine so wo ho ye see yen san so fridge no na enye adwuma so that enam na empro eno nti na ye hwe say there's something more bibi wo ho a eye adwuma bibi wo ho a regulate wo system no wo glands no because yarewa ni nyina fireby eye metabolic disorders glandular disorders ni ade na bibi wo ho a ekitemu a ema omo ye adwuma yie saa ne man nti na anadwi yete ha say ya
ye kase ya ye ni kumi nanso ye gusu a ye yere ye ho a ye kase ya wata we are the mightiest na we bi sa no Queen Porsche say ya ata hope you are good please na ya wo de aka Queen Porsche ara ya wata wa yi we use Juliana the way the yi kan hu Isaac Oje say there is no grace anywhere but the grace is Maame grace period menstruation period eno anu no yen kwa na ye wo wiase obi ni wo baby aka ho Suzy sa pega ne emoji Suzy de mi so dante ase emre wade en fa doctor for what advice ma omo na how they should take care of themselves. I mean niam nketenkete bia you can actually avoid now why you okay we a housewife I mean dem catch them don't be static.
Right.
Body new is made to move.
Right.
Now when you no fuchin now to work and my catch them say sa Bible chapter no masesa no they say the root almost say money is the root of all evil. My rewrites our scripture no sugar is the root of all evil. No money. So be when you seek be evil da. Say money answereth all things. Sugar na no otro na you fee. And ya do to me aka say money is the root of all evil. No aka say money answereth all things. No otro sugar na you fee. Makai so na ko be kan ho a onfa sugar. And yes is very important. Inti doctor to amofo ene yenko.
Okay, so chakras are very important. Your chakras na no ane ye endocrine glands no. Yeah, endocrine glands no so any messages omo de my na so much important. They gives chemicals for our metabolism. They give chemicals for some functionings, hormones, the feelings, oxytocin, ne dopamine. Sa ne man nyina ye ade a wonfa wani enhu omo. So what I say, and to say the yakodi to say heaven, yemfa ye ni hu heaven, yemfa ye ni hu hell. Ni nyina ya idea o ye nipadua mu. I like the part I say mema omont na se din anase boko. So in medicine we call it sedentary lifestyle. So if you are somebody what's also out there what if akro omba ewiemu yen meridian systems no the cranial nerves no omo hia ewia saa empanyimfo aduonu nan na eze omo kotosare onyankopon no omo hia ewia I watched one of your videos before okra obeye madamfo na o kire say yempam the reason why some nti yem balconies ne yen fie no yen to ewia no yema ewia na meye important for us vitamin D enema enan and shorted da me be wiase baby a me fie edu no me nte se a shorted da de di kan e ya asase en ka se ahase wodu ho ama asase asante wuntimi enante ho nti san wachi afi de to so e yem frama ye home eno so ensa afi ewia ebo eno so ewia ebo nso ensa se kusukusu esi se den a ewia bepie afi ensuo nti saa nneɛma wei nyinaa ɛyɛ ade a nipadua ne hia ɛno nti na wohwɛ a it doesn't become scarce
ɛno mpo na making elements no ɛno na elementals
yes nti ɛno deɛ nti make sure sɛ wobɛnya onan bɛtaakye anwea da biara kakra awia bɛbɔ kakra mframa deɛ you can't escape breathing air nti ɛno deɛ constant afei wawia wobɛto wawia na yema yehu ye afi ye ho pɛ no so yento ye boase yempe we so wo se unya nneoma no nyina na ohwere okra e dem fa so ne wo enye se wo hwere okra se wonko heaven it is a medium so there's a particular medium that you have ebetimi ama waye bibia obenya nneoma no nyina afi you don't have that medium again so that's why you resort to medications I will say of course from one country to another country seeking for medical health. You've lost the medium. You've lost
these simple things.
Enti kakra mekano na mema yenhwe se yare we enikio yare we yentimi enso ano yare bia wo ne fa pema yetimi reverse nti ano anwumre kakra me di beja ahwefo.
No, thank you so much. Yeah, I appreciate you. Me who say na wa bre ankasa. And so you came for us. You came through for us. Yeah, that see me be e fra wa pacho. Na wa ba wa. Pacho mpesa wo ba ne ye ka ayi ejaculations no. The enche na edum wo kwan so no.
Okay. So premature.
Ebi mu de tumi dum wo kwan so na omo yirenum di meko ne nchine twa omo aduane mu. Just dey lie no.
Premature ejaculation.
Na wa ba na mba no so omo de na anyi so ato afa so no. Thread ne nchine.
Yes. And
be ye be pimpam ho a.
Yes.
Ya pimpam mo mefro no wa ba na ye di sankomo no.
Emma no so a omo libido so atiko na me.
Anya na me ka ebi de na dum.
Okay yo. So
eja na dum ade na kan nim kura empa enche. Ade na steam ntumi nche meta.
We die Maame fa kakra nka ho Ansah na ya yes a show nuko. A man die no. The sensitive part is the labias. So we have two folds, so the labia majora and the labia minoris. Sensitive on any inside the hole. But a man you kuno. Omukun labias no. Omukun baby a nerves no. Ebe mo ati.
Because a G string omo de atale so twan.
Na
ebi kura de ati afi ho.
Na nneoma na omo de hye ho no. Nneoma no duchis no. And they kun sa.
So omo say no na ema ni omo ye healthy. So wo didi ye na wa supplement na wo swat ya. Wo nya wo didi e kwose ho.
Yes.
Ade na say hancook tie. Bra. Me so kwa bra me guru mi. Me ma wa apo. Be say hancook tie no. You don't need to do it. Why? Abusia ye be fra wa ba na ya discuss sa. Na mbema na de sisi omutira se dodo. Omo afu nyina e pampi young guys. Omo tete tokwan so sa omo tumi nye hwe omo aye mema no. Felix, who are ho? Felix Ajalu or platform. Mema ne de me kasa mamu ana. Nti ye be fra na wa ba na we have ye be nya sa discussion no. Ne ya hwe natural remedies a ewo honomo a enkrofo ebetumi aye abusua in all ade a wo ye no wo secret no ekun wo secret.
That's it.
Feel free what it?
Yes.
Feel free in life. Wenya unya fa. Now obi ya wade let it go. Stop creating tension. Ebe kun cause to me so tension ni mu fa nto bucket mu kata so. You know, love and hate. Feel free. And have peace. Tete adwuma no so na sika obi enya bi wie da. Wate? Ube wu na o ka no sebe. You John bi no abetwi otwi. No need. Eat, feel free and have life. We will all die. Akram why? Doctor, that's why.